before we go into all the functional and structural tests, we will first talk about the clinical evaluation, the clinical methods for evaluating progression of glaucoma. And this is by Dr. DIGVIJAY Singh. Unfortunately, he is also unable to be available here. But he has sent a pre-recorded PPT, so which we would be playing now.
In this presentation, the clinical parameters we evaluate in glaucoma patients include visual acuity, eye pressures, gonioscopy assessing the angles, and looking at the optic nerve head. Parameters we evaluate in glaucoma patients include visual acuity, eye pressures, gonioscopy assessing the angles, and looking at the optic nerve head. Visual acuity is generally not a good parameter to evaluate progression because it gets affected only in the late stage of glaucoma. There is a non-linear correlation with progression. Multiple confounding factors could affect visual acuity. Therefore, it is not a good parameter to assess progression. Worsening intraocular pressure or a shift from a lower to a higher pressure could be a sign of progression of glaucoma. A previously controlled IOP becoming uncontrolled, or excessive fluctuations or IOP spikes, as can be seen in this diurnal variation chart, is also a sign that glaucoma could be progressing. Changes in the angles as seen on gonioscopy, whether it is an increasing number of big peripheral anterior synechiae or increasing pigmentation, or a progressive angle closure with a narrowing of the recess, or an increase in the amount of exfoliative material, may all indicate progression of glaucoma. Probably the most definite sign for glaucoma progression are changes on the optic nerve head, an enlarging cup, development of disc hemorrhages, or increasing peripapillary atrophy all indicate towards glaucoma progression. Changes in the retinal nerve fiber layer, such as a progressive loss of RNFL, is an indication of progressing glaucoma. Tools such as the disc damage likelihood scale may be utilized to document progression. These are the stages of glaucoma as it progresses. It requires both a clinical evaluation as well as perimetry to make the correct staging. Various clinical trials, such as the early manifest glaucoma trial, the ocular hypertensive study, have looked at clinical parameters which may predict progression. These include an increasing age, a higher IOP, worse visual fields, presence of exfoliation, presence of disc hemorrhages, and many others. Once you suspect progression on your clinical examination, the next step involves documenting it structurally using the optical coherence tomography and functionally using the perimetry. Thank you for your patient listening.